Late Night Health continues. We're going to spend some time now with Dr. Leo Doumanian. He is Associate Professor of Urology at the USC Institute of Urology. Gentlemen here in the studio, join in. Doctor, welcome to Late Night Health.
Thank you. Good to be here.
And we appreciate the fact that you're on vacation, visiting family, and participating with us. Do most men in general kind of ignore their health?
Well, the thing about urology is it's kind of a primary care physician in a certain sense, because many times a guy will come to the urologist and they'll have these urinary problems. But if you dig deeper, you'll find out a whole multitude of problems. For instance, erectile dysfunction, as you know or may not know, is a disease of small vessels. So erectile dysfunction in a gentleman, for instance, mid-40s, can be a surrogate for cardiac disease. So in that certain sense, not only am I helping a guy with his erections, which we all, have near and dear to our heart, but I can certainly discover a whole cohort of guys that need to go to a cardiologist and get worked up and hopefully avoid their heart attack 10 years down the line, or you pick up diabetes when you check the urine. So yes, guys are knuckleheads when it comes to their health and oftentimes will avoid it. They'll see a urologist because something as germane as their sexual functioning brings them to me, and as part of my evaluation, you get a whole overhaul of the health system, and then you uncover these things.
And I'm thinking of other issues. I mean, getting up 12 times a night, right, to pee after the age of 45 or 50.
Yeah, for sure. You will be amazed at how many people walk into my office and say, I get up about 5-6 times in the middle of the night. No big deal. Just, it doesn't bother me. In fact, if you sort of recenter a gentleman and say, look, let me try some medication. Let's investigate deeper into your prostatic enlargement or whatnot. And let me show you what normal really is. You'll be astonished at how many guys sort of come to me and say, I don't know why I've been living this way for the last 10, 15 years. I should have seen a urologist sooner. So it's the genital urinary system is important to us men, and we cannot ignore our health, that's for sure.
And there are, before we go to prescription and big pharma stuff, there's also, over-the-counter and, in quotes, natural products that help with this. Have you found any of these to be effective without side effects?
Well, first and foremost, my father always tells me, don't argue with success. If you have a guy that comes into the office and says, I take this over-the-counter, whatnot, medication X, that they bought at a gas station, and they say, my urination is great. As long as I look at the ingredients and there's nothing deleterious or anything that could be harmful to their health, I'm like, yeah, that's great. Continue it. We do know there's some natural ingredients, and naturopathic medicine, as you know, is making a great push in these times that do help with prostatic health, such as saw palmetto, which has been around for a while, which is from the bark. There's all these surrogates for finasteride, which is a medication that helps shrink the prostate. There are all kinds of sort of old wives' tales as well. But one that's good is I always tell my elderly gentlemen, eat lots of tomatoes, because lycopene, which is a sort of component or ingredient in tomatoes, certainly helps with prostatic health for the long run.
It also helps with eye health, doesn't it?
Yes.
Yeah, absolutely.
Right.
Absolutely.
So now, if you haven't been able to see it for a while,
there you go.
You can see it. What percentage of men have prostate issues, say, after 50?
Okay, so in my office, and my specialty is sort of lower urinary tract dysfunction, male pelvic reconstruction, erectile dysfunction. At least 50 to 75% of guys walking through my front door have some kind of issue. Whether or not that is a clinically significant issue that we sort of treat or we start evaluating, that's one thing. But most guys, as they reach the age of 50, will start seeing a deterioration in their urinary mechanics. And it comes down to a quality of life parameter. Does it bother the gentleman? If it bothers them, then we do something about it. If it doesn't bother them, then we sort of monitor it. I always tell my patients as well the following. I have 80-year-old guys that are swimming in their urine, are wet as can be, and they couldn't care less with a smile on their face. I have 45-year-old guys that have one little post-sport dribble in their underwear, and they drive them crazy. So it really is a case-by-case quality of life sort of parameter that you must judge at the individual level.
But most guys do have an enlarged prostate after, it starts growing at a certain age?
It starts growing. I tell my patients as well, women have have their menstrual periods and have to deal with that throughout their life. But the women get back at us men as we get older because our prostate's enlarged. So every decade you see potentially a 1 to 5% growth of the prostate. In some guys it's more accelerated and significant. Most men will have some form of enlarged prostate and or prostate cancer if they live long enough, that's for sure. That's certain that the natural course and history of the prostate is that it will enlarge and you will have little islands of cancer if you live long enough. Whether that's clinically significant, therein lies the art and science of medicine and urology.
And what about the cancer aspect? My understanding is that there are different kinds of prostate cancer. Most being slow growing. So an 80-year-old man who's diagnosed with prostate cancer may not necessarily need surgery.
Well, here's the deal. Prostate cancer is a big topic of discussion. And there's many camps that have differing opinions and views. At the end of the day, it's a heterogeneous disease, meaning different prostate cancers act in different ways in different people. Until we can figure out which prostate cancer will kill somebody and go on to sort of destroy their life in terms of their quality, their ability to urinate, metastatic, bone disease, and whatnot, we have to sort of err on the side of over-treating. So we have all these men that get these PSAs. Some of them are justified, some of them are not. So you get an elevated PSA, and then you must sit down with the patient and have a informed discussion, which oftentimes can take quite amount of time in your office hours, where you discuss at length the risks and benefits of having a prostate biopsy. Okay, because nowadays not every prostate cancer, as we were discussing, will go on to kill you and spread, but you have 70-year-old men who are quite healthy, who are going to live several years with a very low risk, very non-aggressive prostate cancer that's picked up on a biopsy, and we have a new way of thinking. Rather than jumping in and treating it, we can actively watch it and survey the cancer. So there's so many options. All it comes down to is the patient-doctor relationship and informed consent, as well as informed sort of discussion and a knowledge of what is going on with your health when it comes to prostate cancer, elevated PSAs, and biopsies.
And now that we've established that, let's talk about somebody who wants an active sex life but has erectile dysfunction and has tried everything. They've tried over-the-counter materials. They've tried Viagra and other pharmaceuticals. There are options for ED, and if anybody's interested, they can learn more by going to edcure.org. That's edcure.org. Tell us about those kinds of options, Doctor.
Yes, certainly. The beauty of erectile dysfunction is it's an algorithmic treatment protocol. You start with the least invasive, and then you get to the most invasive option, which is discussed on the website, centers around surgical treatment for erectile dysfunction. If you can't get an erection, you've failed pills, you've failed other modalities such as injections or little pellets you put in the urethra, and there are real durable surgical options called an inflatable penile prosthesis that is done in an operating room under sterile conditions, which has a very high satisfaction rate, takes about anywhere between 45 minutes to an hour and a half to perform, and there are hundreds of thousands of men out there who are very happy, very pleased with their implant. It's a 3-component device where you put cylinders in the erectile bodies in order to maintain an erection when you desire to pump up the cylinders and fluid is transferred from a balloon reservoir into the cylinders, and then you have an erection that can last as long as you want. And then when the erection or when the sexual relations are over, if you so please, you can deflate it with a one touch of a button. It's a self-contained system. Everything is implanted in the body. If you would stand in front of a mirror, for instance, naked, no one could tell most of the time that you have an implant. And I have several men that are thrilled and have changed their life after they have had the implant.
How do partners react to this? I mean...
Well, that's a good question. Because many times when a man comes to me and we've reached the point where we're talking about surgical correction with the 3-piece inflatable penile prosthesis, I will encourage them to bring in their partner. The partner comes in and we discuss, first and foremost, do you understand what we are talking about? And second of all, we talk about sort of statistics that we have done studies on, which the partners are as pleased, if not more pleased, than the actual patient themselves, because once you rejuvenate a sex life, you open up all kinds of avenues for enjoyment of life. And once again, this comes down to quality of life. The urological business centers around quality of life. Sexual performance and functioning is a very, very important aspect of this. When you take a man who cannot have an erection, you give him an implant, they're able to please their wife, they're able to increase their self-confidence. It opens up the world, and that is the most important thing that men should take away from this sort of discussion, is that you shouldn't be afraid to move forward with an implant if that is what sort of you are interested in, and be confident that you and your partner will certainly benefit from your decision.
When we come back from our break in just a couple moments, we'll talk about the psychology of this. But what about achieving orgasm with the pump? Can the man also achieve orgasm, or is it just released for or orgasmic for his partner?
Well, it all depends on the etiology of the erectile dysfunction. First and foremost, I like to tell my partners that the center of the brain that controls erections is different than the center of the brain that controls orgasms. So if you have prostate cancer and your erectile dysfunction is a direct effect of the prostate cancer, you're not going to have an orgasm. You may have the pleasurable feelings in your brain, but the actual emission or ejaculation will not occur. Other men with diabetes or hypertension, yes, you may very well have an ejaculate continue. So one shouldn't fear that it's going to mess with that mechanism.
Our guest, Dr. Leo R. Doumanian. He is Associate Professor of Urology at USC Institute of Urology and the Keck Medicine of USC. Gary Stewart is in studio with us, along with the insane Daryl Wayne. I'm Mark Alyn. If you want information on this, it's really quite interesting. It's a great website. Go to edcure.org, edcure.org. Late Night Health continues with Dr. Leo in just a couple moments as we continue.
Late Night Health with your host Mark Alyn continues in a moment.
The experts at Web.com want to build your business a successful website for free, just like we did for these current Web.com customers.
We've looked at other website designers. There's nobody better than Web.com.
Web.com can build your website in as little as 7 days free. Plus, we'll promote it on all the major search engines. If after 30 days you're happy, we'll continue to provide promotion, hosting, support, and maintenance, all for one low monthly fee. If not, cancel and pay nothing.
If you're in business and you don't have a web presence, you won't be taken seriously.
Call right now and you'll also get a free .com or .net domain name for your new website, powered by VeriSign, the world's leading domain name provider.
No upfront charge for site build, after which ongoing fees apply. Rights to site are relinquished when canceled. Domain included during active service, after which fees apply.
800-489-8751. 800-489-8751. 800-489-8751. That's 800-489-8751. Attention users of the blood-thinning drug Xarelto. If you took the drug Xarelto and experienced complications such as cerebral hemorrhage, gastrointestinal bleeding or other internal bleeding, or if a loved one has died after taking Xarelto, you may be eligible to get a cash award for your suffering. Call the Xarelto Help Hotline now at 1-800-264-3150. That's 800-264-3150. To qualify for a cash settlement, you must file a claim before the deadline. So don't miss your opportunity for a cash settlement. Call 800-264-3150 now for a free, no-obligation consultation. Our call center is open 24/7. So if you took the drug Xarelto and experienced cerebral hemorrhage, gastrointestinal bleeding, or other internal bleeding, or if a loved one has died after taking Xarelto, call the Xarelto Help Hotline now at 800-264-3150. 800-264-3150. That's 800-264-3150.